From stories across the world to stories here at home, this is the National News Broadcast. A very good evening to you. I'm Nitya Delivera.
A very good evening indeed. I'm Javed Bongzo and we begin with the headlines of tonight's news.
Essential services are being conducted without obstruction despite the imposition of travel restrictions. A series of guidelines pertaining to PCR and rapid antigen tests being conducted in private hospitals. 3 main water supply schemes, which provide relief to 190,000 persons, have been declared open. Instructions have been given to refrain from engaging in fishing and naval activities in the sea area around the island from tomorrow until further notice.
Now, in your top story this evening, police state that travel restrictions are being implemented sternly and continuously throughout the island. However, measures have been taken for the continuous maintenance of essential services without any disruptions. The travel ban imposed throughout the island will continue till 4 a.m. next Tuesday. The ban will be reimposed at 11 p.m. on the same day. It will be lifted once again at 4 a.m. on the 28th. All arrangements have been made for the supply of essential consumer items without any shortage during the period of travel restrictions. However, all shops other than pharmacies should remain closed during the period of travel restrictions. Trains and other common transportation services will also not function during this period. Fishermen in areas not under isolation are permitted to engage in fishing. Steps have also been taken to distribute fish stocks to the isolated areas by mobile vehicles. Permission has also been granted for the opening of only wholesale fish centres. Fish sales outlets at fisheries harbours have also been permitted to engage in activity. The police have implemented a special program for the systematic maintenance of the travel ban. Police media spokesman DIG Ajit Rohana said that if any person wants to be hospitalised, there is the opportunity to do so. Similarly, the people are permitted to leave for hospitals in their vehicles or in hired vehicles. Services relating to health, food, medicine, import, exports, disaster management, water, electricity, fuel, media, energy have been declared as essential services. Those who are engaged in duties in these services are permitted only to engage in such duties. Production-related industries could be carried out under the bio-bubble concept. There is permission to engage in the bakery industry as well. Similarly, those who are engaged in the construction sectors are permitted to function without obstruction. Employees in supermarkets, the sattas and wholesale units are permitted to engage in packaging of items within premises. Permission has also been granted for farmers to engage in agricultural activities despite the imposition of the travel ban. Accordingly, farmers engage in their cultivation activities as usual today. Only authorized businessmen are permitted to engage in the transportation of essential items under a delivery system during the period of travel restrictions. Such traders were seen engaged in selling goods in different parts of the island. Colombo District Secretary Pradeep Yasaratne says that in the event of any location in the Colombo district subjected to isolation during the period of travel restrictions, the low-income earners in such areas will be provided a bag of rationed items valued at 5,000 rupees without any obstruction. Postmaster General Ranjit Aryaratne says that a grace period will be provided for the general public to pay fines on motor traffic offences to post officers. Fines issued on or after the 5th of April are being exempted from double payment, taking into consideration the pandemic. Accordingly, the fines of which date of expiry has passed the 14-day period could be paid at any post office or sub-post office throughout the island without a payment or an additional fine. The relief is to be extended until further notice. Towns throughout the country were seen deserted with the imposition of the travel restrictions. Security divisions are engaged in search operations in all parts of the island. Now, in the meantime, Dr. Hemant Herath on this occasion has clarified in depth the tasks of the epidemiological unit on the controlling of the COVID-19 expansion.
Talking about the epidemiological unit, we have seen several reports, concerns aired regarding the efficiency of the epidemiological unit and the activities of the epidemiological unit. As the Ministry of Health, we should emphasize that the role of the epidemiology unit in controlling this epidemic in the past 2 years, I think it is remarkable and exemplary, and compared to many other countries, we have achieved much more results, and main contributor for this success was the epidemiological unit. They were the people who were ready to face the initial phase of the epidemic and to provide the necessary guidance to the health ministry and all other stakeholders and managing the epidemiological aspects of the epidemic. They did it remarkably well, and we should appreciate that. And collection of data was carried out initially with the limited number of staff available, but gradually the number increased, the human resources capacity of the unit was increased, and the amount of data collected and stored and analyzed in that unit increased, and that reflects in the website of the epidemiological unit, where initially we had very small amount of information, but nowadays we can see that many new information, new analysis is being done, and these are available on a daily basis, weekly basis in the website, and that can be accessible to the public. And also weekly analysis, or sometimes people are expecting certain information on a daily basis, which is not practical. For example, the daily death analysis is not realistic because certain deaths are confirmed few days later, and as a result the Ministry of Health and the epidemiological unit is still giving the same analysis on a weekly basis, and that is what the epidemiological unit is doing currently. And I need to again emphasize that there can be certain information that is either not available in the epidemiological unit or not readily available in the epidemiological unit, because certain specific information, even though the information is collected, unless there is a specific need for the decision making, sometimes all this information is not analyzed, processed and taken into specific platform. Basically, at a given moment, it is important to identify the vital information for decision making. So, if somebody is requesting some information that was not routinely used for decision making, sometimes it will take little time to get this information. So that is the reason why most of the time certain information is not available on time, but the Ministry of Health always the right of the people to know the information, and therefore whatever the information is that is available will be disseminated. And if somebody needs any information, please contact the epidemiology unit or the Ministry of Health. We will do our best to provide that.
Inoculation of the second dose of the Covishield vaccine and the first dose of the Sinopharm vaccine under the COVID-19 immunization program is being carried out successfully. 22,617 persons have received these vaccines yesterday. Dose of the Covishield vaccine has been delivered to 6,497 persons yesterday. The number of those who have so far received the second dose of this vaccine is 320,196. The first dose of the Sinopharm vaccine has been provided to 16,120 persons yesterday. Up to now, 514,093 persons have been vaccinated with the Sinopharm vaccine. The Ministry of Health has issued specific guidelines for the PCR and rapid antigen tests to be conducted through private hospitals. The instructions have been informed in writing to the officials in charge of laboratories in private hospitals. Accordingly, relevant tests have to be conducted according to the recommendations of the medical specialists in charge of the diagnosis of the disease condition or any other responsible medical authority. The patient should be ordered to undergo quarantine in their residences or other places of stay until receipt of results or the sample tests. It is the responsibility of the hospital authority to inform the epidemiology unit to the Ministry of Health, the medical officer of health in the relevant area, and the patient in the event of detection of the affliction of COVID-19 disease to a patient. The hospital authorities should also take measures to place the infected person at an authorized COVID-19 treatment center according to the recommendations of the relevant physician. The Director General of the Health Services also informs that the permission being granted to private hospitals for the conducting of PCR and rapid antigen tests on COVID-19 disease. A further of 2,145 COVID-19 patients were detected today. 1,635 fully recovered patients have left the hospitals today. Accordingly, the total recoveries in the country has increased up to 126,995. A total of 32,351 COVID patients are still receiving treatment. A total of 44 COVID-19 related deaths have been reported yesterday. The Director General of Health Services says the deaths have occurred from 2nd to the 20th of this month. Out of this number, 23 victims were above the age of 71 years. 11 of the victims were between the ages of 61 and 70 years and 7 between the ages of 51 and 60 years. 2 victims were between the ages of 32 and 40 years. The remaining victim was a 22-year-old woman. Minister Kehliya Ramukwail has observed activities of the transferring of the Mahamauna Meditation Centre into a COVID-19 intermediate treatment centre in Kundasale. Venerable Kiribat Gurinananda Thera has given permission to set up the Corona Treatment Centre at the Meditation Centre. Venerable Nalanda Pavara Thera of the centre and Parliamentarian Vasantayapa Bandara were also present on the occasion. The long-felt need of a PCR machine at the Polonnaruwa Hospital was fulfilled today. A sum of 6 million rupees has been spent from the Polonnaruwa District Development Fund for the purpose. State Minister Roshan Ranasinghe has donated 50 electric fans to the hospital through his personal expense. The training centre of the Ceylon Electricity Board in Piliandala has been converted into an intermediate hospital for the employees of the board itself. Minister Dallas Alhaperuma says that the decision has been taken for the conversion in recognition of the commitments of the electricity employees in the face of the COVID pandemic. He further says that a special health allowance of 150,000 rupees will also be provided to the workers in addition to the annual insurance scheme.
Now, Prime Minister Mahinda Rajapaksa says that pure drinking water will be provided to all citizens in the country by the year 2025. He made these remarks participating in the occasion of vesting in the general public 3 major water supply schemes yesterday. 3 large-scale water schemes, the Dadrioya, Galigamo and Hapugala, have been declared open yesterday. The Prime Minister joined the events from Temple Trees over Zoom. The 3 projects provide relief to more than 190,000 persons experiencing shortages in drinking water facilities. The Office of the Prime Minister says residents in 7 divisional secretariat divisions in Kurunagala, Gaul and Kegaul districts are benefited through the new water projects. The government has spent 10,227 million rupees on the Dadru-Oya water supply project. A sum of 2,300 million rupees has been spent on the Galigamo water supply scheme and 325 million rupees on the Hapugala water supply scheme. A special feature has been that a high percentage of construction was carried out by local engineers. The Water Supply and Drainage Board and other local institutions have been responsible for the implementation of the projects. Prime Minister Mahinda Rajapaksa said that water available for drinking purposes of the people is being polluted by the people. He further says that the disastrous situation cannot be controlled through legislation only. The Prime Minister further said that therefore children should be educated on the importance of the purity of drinking water from childhood. The importance of water was understood in the past. We are experiencing today the outcome of their endeavours carried out in the interest of the future generations. The Prime Minister also said that they have realised that mere utterances on the drinking water problem would not resolve the issue. He added that it is regrettable to state that according to reports of the Water Supply and Drainage Board that only less than 50% of the country's population have access to pure drinking water. The aim to provide clean drinking water to the entire population has been included in the Saubhagya Dakma policy statement. The Prime Minister also said that accordingly steps have been taken to set up major water supply schemes throughout the country.
Parliamentarian President's Counsel Jayanta Veerasinghe says many people have forgotten today on the draft bill presented during the regime of J.R. Jayawardena to turn black money into legal currency. The parliamentarian at a media briefing yesterday said that it is hilarious to find certain groups engaging in propaganda today pertaining to the possibility of the port city engaging in such nefarious activities. Parliamentarian President's Counsel Jayantavir Singh has said that the Money Laundering Act of 2006 is available to prevent the black money turning into legal money. The act has been presented by the Mahinda Rajapaksa government. No other government had made any attempt to take any measures to rectify the situation. He has recalled that it was during the regime of J.R. Jayawardena that facilities had been paved way for any foreigner to bring black money into the country through discreet methods. At that time, R. Premadasa was the Prime Minister of the country. The Met Department of Meteorology informs all concerned not to engage in fishing or naval activities in the sea surrounding the island from tomorrow until further notice. Those who are already engaged in fishing at sea should return to the inland or to a protected area as soon as possible. The department forecasts that this low-pressure condition developing in the northeastern direction in the Bay of Bengal has a tendency to emerge as a minor storm by the 24th of this month. Wind speed across the island could increase up to 50 to 60 kilometers per hour at times. The meteorology report further says the wind speeds in the western slope of the Central Highlands, in the northern, north-central, northwestern Uva provinces as well as the Hambantota district could sometimes increase up to 50 to 55 kilometers. Our correspondent says Uyanwata Reservoir in Bandaragama has begun to overflow as a result of the heavy rainfall. Fishermen in the northwestern coastal line have refrained from engaging in fishing activities temporarily due to the fact of the sea turning rough. Fishing crafts were placed on boatyards stretching from Kalpitia to Wenapur on the beachfront. The Department of Meteorology further says that the wind speeds in the sea areas around the island may at times increase up to 30 to 40 kilometers per hour. Meanwhile, a media briefing to enlighten the relevant groups on preparations and activities pertaining to the southwestern monsoon was conducted today.
Now, in the meantime, Prime Minister Mahinda Rajapaksa has inquired on the progress of the preliminary stage of the program to develop the Kurunegala Provincial Hospital into an ultra-modern national hospital. A meeting in this connection took place at Temple Trees yesterday. It has been pointed out at the discussion that the Kurunegala General Hospital caters to the medical needs of 10% of the entire population of the country. The hospital provides direct treatment facilities to people in 5 districts including Kurunegala and Putlam. The Prime Minister inquired information from the relevant parties regarding the acquisition of land reclamation and construction relating to the new project. The hospital is to be reconstructed with exceptional facilities. They include setting up of a teaching hospital as well as provision of surgical services, child and maternal health facilities. A fully pledged Bhikkhu ward complex is amongst many other features to be included. The hospital will be constructed under the green concept comprising of an internal bus stand as well. It will also have direct road connections to the expressway and the railway station. The hospital development plan has been jointly prepared by the political authority headed by Minister Johnston Fernando, the Ministry of Authority headed by the Ministry of Health, the Government Medical Officers Association, the Urban Development Authority on the instructions of the Prime Minister. Prime Minister Mahinda Rajapaksa has pointed out that all new construction should be carried out without causing any obstructions to the existing services of the hospital. In addition to the project, a further sum of 602 million rupees has been set aside for the development of regional hospitals in the northwestern province during this year. Minister Namal Rajapaksa, focusing attention on the COVID vaccination program, said that it should be conducted in an efficient manner without causing obstruction to the general public. The minister has explained how the people could be educated on the program through a computer app. He has also pointed out that an alternate program could be implemented on behalf of the people who do not use latest technology. Ministers Johnston Fernando and Pavitra Vanyarachi statements of Dayasri Jayasekara, Parliamentarians B.Y.G. Ratnasekara, Sumit Udukumbura, Samanpriya Herath, Charita Herath and Manjula Disanaika, Chief of the Prime Ministerial Staff Yoshita Rajapaksa and state officials also participated.
The fire that has erupted in a ship at the sea closer to the Colombo harbour is reported to be continuing. The Sri Lanka Navy, the Sri Lanka Air Force, the Ports Authority and a tugboat of an international rescue company are engaged in dousing the fire. Fire on the MV Express Pearl has commenced on the 20th of this month while it was arriving at the Colombo harbour from the Hasira harbour in India. The Navy says the ship was anchored in the North Sea, 9.5 nautical miles away from the Colombo harbour. When the fire got underway, the vessel in a container ship, poison fumes have begun to emit as a result of leakage of nitric acid in one of the containers with water. Since then, the craft of the Port Authority and the Navy have been engaged in the extinguishing of the fire. A helicopter of the SLAF has sprinkled a special chemical powder from the air on the smoldering vessel several times. Meanwhile, chairperson of the Marine Environmental Protection Authority, Darshini Lahadapura, said that officials on an institution, the Port Authority, the Merchant Navy Secretariat as well as Navy personnel have gone close to the ship and inquired on the situation yesterday. Flames were seen erupting from time to time in between the containers even this afternoon. The Navy says several tugboats continue to engage in cooling measures. The Sindhurala craft and another speed craft of the Sri Lanka Navy have been positioned in the nearby sea for assisting in the operations.
On to another local news item in brief. A new app has been introduced to facilitate the receipt of all services being provided by the Department of Examinations of the Ministry of Education through mobile phones from the residents itself. The app has been named Exam Sri Lanka DOS. According to the digitalization policy, the app is to be introduced in all three languages, Sinhala, Tamil and English. This would enable the recipients to submit applications to search the examination numbers, to search past school examination results as well as institutional examination results, and also to confirm such results. The introduction of the mobile phone app was conducted under the patronage of Minister Professor Gio Paris in Colombo yesterday. Secretary to the Ministry of Education, Professor Kapila Pereira, was also present. Now, the Pirit chanting ceremony to bless the entire world community through the elimination of the corona pandemic concluded at the Abhayarama Viharasthana in Narahempita yesterday. The Ratana and Girimananda Sutras have been chanted for 7 days. The event has been organized under the direction of Chief Incumbent of the Abhayarama Vihara, Venerable Muruttettuwe Ananda Thera.
And in news from the sporting world, the Ministry of Sports and the National Sports Council have entered into an agreement yesterday to develop the sport of beach volleyball in the country. The aim is to uplift technological and other facilities pertaining to the sports. Director General of Sports Amal Edrisuriya and Secretary to the Sri Lanka Volleyball Association S. Nalaka have signed the agreement on behalf of the two institutions. Mr. Namal Rajapaksa and President of the Sri Lanka Volleyball Association Kanchana Jaratne were also present at the occasion. And that's it for tonight's news. To watch us tomorrow at the very same time. Good night.
Good night.